So I want to talk first about what the progression of the intervention is. And we have developed modules that we use in the intervention as a way of teaching parents primarily, but we actually teach therapists in exactly the same way. So the first phase of the treatment is to figure out the foundations of engagement. So we talk about the engagement states and the play levels. So we talked about some of this yesterday. Then we're going to set up the environment and try to understand the child's behavior in that environment. We're going to follow the child's lead, and we're going to try to establish some routines. So that's the first phase of development. So it'll go along week by week, usually, when we do the intervention with parents. With therapists, we're going to teach you just like we would teach a parent, but of course you're going to know all of the strategies before you actually try to mediate through a parent, right? So if you're working directly with a child, then you know all of these strategies. But the way to learn it, I think, is still in this same kind of sequence. It's just easier. The second phase is where we start to actually get into some of the skill development. So we don't do that in the beginning. The first thing is to try to just establish the environmental control and establish some routines that are in the child's interests. So the second phase is to think about this balance between imitating and modeling, right? So how directive we are, how much we teach. And then we'll talk about building more meaningful everyday routines. So thinking about those routines as having meaning to the child's life. Whether you're in the home and you want to go across everyday routines, or if you're in a lab, it's a different situation. If you're in a school, it's yet another situation. And then we'll introduce joint attention skills. So while this is a joint attention intervention, we're not starting from day one trying to get those skills from the child. So we have to establish some other things first. And then this occasioning joint attention, so allowing joint attention to occur. The final phase is really thinking more about language. Now I know that seems odd, right? Because it's a communication intervention, but our language, especially for a parent, we try to clean up the language towards the end after you've got the child already engaged. So it seems easier, and I know we have SLPs here, and that just seems totally wrong. So we talk about encouraging more communication, and then trying to jumpstart the spoken expressive communication. Okay, so let's talk. This is all in your manual as well, so you don't need to write it all down. Joint engagement states. So when we think about this, we start at the bottom. This is based on the work of Adolescent and Bakeman. And so children are observed in their environment, in interactions, and we think about what their state of engagement is. So at the very bottom, you have a child who's unengaged, right? He's not engaged with a toy or a person. So we saw examples of that yesterday, right? The child wandering around the room. They might be scanning the room. They might just be wandering and not really know what to do with the people and the objects in the room. So that's a state we want to change, right? So we don't want children to be unengaged at all if we can help it, but not for long periods of time. The child might be onlooking, so they might be kind of watching what's happening in their environment, but they're not really engaged themselves with that person or with the objects. You see this more often, I think, in school environments where you see children watching other children play, but we also see it even with children and their parents when they have objects in the room. They might just be watching what the parent is doing. And then sort of object and person engagement kind of come in developmentally at the same time. So you have a child who's very, very person engaged, for example, a very young infant tends to be more person engaged. They're really drawn to whatever the adult is doing or talking about or playing a game. Or once they start getting a little bit more upright, they're much more object focused. So when children start to sit up around 6 months and they are fairly stable, they discover objects and then they become fairly object focused. But with our kids who are somewhat older, we can see the same thing. A child who just wants to interact with the parent or hangs on the parent, or the child who just gets really engaged in the object and can't shift their attention. So those two states, while they're a little bit higher level, we also want to change those states, right? Especially for a child who's, over 2. We saw 2.5-year-olds. So we want them to engage with objects and people. So supported joint engagement is where we're trying to get to, especially with these little guys we saw yesterday who are 2.5. So developmentally, they're at this point where they should be spending the majority of their time engaged in a supported, engaged interaction. And then we want to move them to coordinated joint engagement. But in supported, the child and the adult are engaged around the same object or routine or activity. But the child may not be looking at the parent or showing them. They may give an object but not really look at the parent. So the child is in the engagement, but there are not clear signs of coordinating. When you get a child who can coordinate the interaction, they're basically saying, let's do this, or they're directing the action and the activity. And of course, that's where we're going. But we're going to spend a lot more time in supported joint to develop that. Okay. Yes? Mm-hmm.
For typical developing kids, where would you start seeing that supported go to coordinated?
Well, between 18 and 36 months.
So
there tends to be a big chunk of supported joint. But clearly, kids are moving into coordinated joint engagement through that period of time. It's increasing over time.
Okay.
But still, supported joint is a big chunk.
So for some of our children who are functioning more at that 12-month or 10-month level in play skills, then they're not there yet, even if they're 2 or 2.5.
They might not even be there, but we can create supported joint for them. But we might have shorter periods of supported joint and going in between sort of person engaged, getting them back into object focus. You'll have moments of object, and then, of course, trying to get more of the supported joint. Yeah, so it's kind of a balancing act. You just want to understand the process of where you're going. But we're not going to jump that process too fast. It's okay to be in supported joint. We don't need to recruit a lot of attention. And we'll give you some strategies for how to just know that you're engaged with the child, and hopefully those skills with some of the strategies will develop. Okay, so the first module, and what we think about from the beginning, and what we'll talk about with parents, but you will need to know as a therapist, is just setting up the environment. So thinking about what context you have. So are you in the lab? That's, much more controlled. You can set that environment up to be just the way you want it to be. Are you in the home? Right? So that's a much more naturalistic and probably preferable situation if you can be there. Are you in the school? So with somewhat older children, you might be in the school environment. So we think about distractions. What are those distractions? So in the home, the TV, the telephone, right? Those are big distractions. Those are naturally occurring distractions. One of them actually both of those we can control to some extent if you want to have, a pretty constrained time if you're just there for, let's say, an hour. So you can turn off the TV, you can turn off the phone. But you may not have complete control over that. So you need to consider that. Inappropriate toys for that child's developmental play level. So a lot of times there are a lot of mechanical toys. There's every kind of sound making, singing, buzzing toy, especially in the home, because that is what motivates the child. And so you have to think about how many of those you can use. We tend not to use very many of those. We tend to take batteries out of toys when children are learning to engage because they're too distracting. So as they get older, those might be something that they would want to play with, but oftentimes they become very object focused with those kind of toys. So all toys in the lab, for example, they don't have batteries in them. And then you might have limited space, right? So this is especially true at schools, where you may have to see a child, if you're seeing them one-on-one, in a hallway, outside, on a picnic table. You just don't have space. Even in a home, where is the space that you want to engage and play, if that's the goal? If you want to have like special playtime, which I think is appropriate for younger kids. As kids get older, it's very difficult for parents to sit down and play. So how realistic is that? That they're going to set aside time to play. So then you want to think about the strategies that they can use in the moment. So during daily routines, whatever their daily routine is, you might walk through the home and talk to them about their daily routine, see where there are issues that are problematic. Transitions, for example, we saw some of that yesterday. How can we help mom with transitions from one activity to the other that she has to naturally do? So those are important considerations. You can still use these strategies, but you may not have a focused playtime. So there's a difference between what you can do. You can do a lot in therapy, but you may not have that luxury in all situations. So we think about the physical environment when we think about setting up the environment. So it's people, right? So where are you vis-a-vis the child? So we like to have parents or therapists sit in front of the child and at their eye level. So getting down low to the child. A lot of times the adult is not at eye level, and yet they're recruiting attention all the time, so the child's having to look up. For the little guys we saw yesterday, they're not that stable, even sitting comfortably, so that's a big challenge for them. So we want to be at eye level. Let's see, toys. Oh, toy choice. So we talked a little bit about mechanical toys. We tend not to choose those, but we want to have developmentally appropriate toys. So we talked a lot about play level yesterday. So when you think about play level, you think about, well, what toys will motivate this child at that toy level, right? So for the second little boy who's at combination play, we're going to have lots of different options for him that are all at that play level. All right, so those are going to be available in the room. So it's not just one toy. The other, I think, difference between what we do and maybe what some other interventions talk about, even though they sound the same, is we like to develop routines, play routines, and that can involve multiple play sets. So if you watch typical children play, they play with one toy, they move to another toy, and then they go back to the first toy, right? So they've remembered that they want, they're flexible in what they want to play with. Now, if the environment is too chaotic and you have too many objects around, that's chaotic, it's confusing. But if you have a number of different toys, they're available for the child to move between, to add together, to expand your play routine. And it's okay, it's preferable, right? Because you don't want to lose periods of engagement. You want to keep the child as engaged as long as possible. So it's a little different than the joint action routine, which is described as a play routine having a clear beginning, a middle, and an end. And we have that as well, but it just keeps cycling and expanding. All right, so there's not a clear ending where you clean up, put it away, and now we're going to play with this toy. Okay, that's a little bit too sterile or directive for our treatment. Does that make sense? Yeah? Okay. Okay, so the first thing that we're going to talk about, and we've selected, sort of based on the children we saw yesterday, we've selected just certain modules that we're really going to concentrate on because we don't have a lot of time, but in the manual you'll see all of the different modules, and the sequence can be flexible, but we've found that with almost every child we go through this same sequence, but it's not like you have to do it exactly in that way. So, following the child's lead, you want to play with the toy the child wants. Now, that's a very confusing statement. So, you know, some people think, oh, well, so he's wandering around the room and we're just going to follow him. We're not going to do that. So we want to give him or her a few moments. Like they come into a room and they see all these toys, and it takes them a few minutes to say, ooh, what am I interested in? So we're going to follow that child where his eyes are focused. And when it looks like he's selected a toy, we're going to go to that toy and we'll see what he does with it. All right? So we want to follow his lead. It's not like we say, oh, there's his eyes, and so now we're going to take that toy and we're going to tell him, this is how you use that toy and this is what you do. We don't want to do that generally. There are children who need a lot more structure, and so you're going to use your clinical judgment on that. But in general, you want to wait to see how the child picks up the toy, how they play with it, and then we're going to imitate what the child does. Okay, so we're going to imitate what they do with the toy. So that means that we're going to have a toy just like his, or we're going to do something very similar to what he has just done. And that doesn't mean that we would imitate everything the child does. So if the child is being very, repetitive in an inappropriate way, using some repetitive behavior or a repetitive vocalization that's not appropriate, we don't imitate that, right? So you're imitating appropriate actions. Now, the child may be interested in that first toy, but they may quickly decide that they want to go to a different toy. That's okay. Follow their interest. Because if you can't get it, the routine developed there, you might get it developed with the next one. So they might flit a little bit in the very beginning, but that doesn't last very long. And you want to make sure that you get this routine going. So first thing is follow the child's lead. I'm going to show you a little video clip, and we're going to orient you to what we want you to pay attention to. Now, these video clips are ones that we could show you, and they're usually in the moment of therapy. They're often with parents and their child, and so they often are not perfect. We're going to show you the parts that we want you to orient towards. So here's I think a therapist, who is following the child's lead. So they're starting to play with the train tracks, and you'll watch what the child's behavior is, and we'll talk about it after. Let's see. So I'll show it to you again because we don't have sound.
We can restart it again after
We can.
it ends so that it doesn't freak out on us.
It's very short, so it's going to help that we actually see it again. All right. Okay, so he was playing with the train. You know, they may have had a routine with that train. His interest shifted. He didn't really seem that interested in going forward with that. He found something else. She brings it over. She's going to try to combine it with the other activity, right? So that's what we mean by following. Does that make sense? Right. So how do we establish? Oh, we have a question. Mm-hmm.
I wonder what would happen if the child is one of those children that would rather wander than sit down and play. Because I know that there's a lot of children that they'll play by themselves, but the moment you sit down with them, they kind of just get up and go to the next toy. And if you go to that toy, they get up and they go to the next toy.
That's a great question. So that's a child who isn't used to having someone engage with them. We see this a lot It's very common. And one question is, why is that happening? Is that happening because every time that they play with or work with another person, that person's directing what they do? So they want to have their own time to play because they don't want demands placed on them. So I think that's a really critical issue, and that's what we try not to do in this intervention. So you'll see a little bit later, I'm going to talk about an unengaged protocol. So to me, that's a child who's, well, he's object focused. He moves to the next one. He's unengaged with you. So it's kind of the same issue. So you're going to have to build tolerance for him to interact with a person. And the way you're going to do that is by doing exactly what we just did. You're going to follow his lead. You're going to imitate what he's doing. You're not going to sit down and then say, oh, can I play this? Or let's do this. Or what color is this, right? So you're putting demands on him. So the best thing is just to follow in to what he's playing with, imitate what he's doing in a very nonchalant, sort of easy way, and then just build, you're going to build his stamina for interacting with a person and objects. But first he's got to trust you that you're not going to demand that you do what he wants, what he doesn't want to do, but what you want him to do. Okay? I hope it'll be clearer as we kind of go along. It's not easy. It's not, and you know that. It's not easy. So how do you establish a routine? So you want to work with the parent, or if you're the therapist, you're going to work with the child to build a routine for how to play with the toy. You know, the different ways that you can play with the toy. So a play routine has a few predictable sequences of events. You have clearly defined roles, what you do and what he does, okay? This will be clearer, I hope. And you have consistent words or phrases at each step of the routine. So that's where you get, as a therapist, you're getting that language input. With the parent, we're not going to worry so much about how the parent is talking in the beginning. It's very hard to establish the engagement and the routine. Don't want to give people, you don't want to overload parents with too much to think about in the beginning. Some parents just naturally are great at this, but you know, others want to talk a lot or they don't talk at all. So you're going to clean that up towards the end. And sometimes it just naturally comes along, so you don't have to intervene that much. So let's look at establishing a play routine. And this is, you know, one toy, very simple routine. Okay, so that's just one toy, very simple. This is a child that's basically at a very simple play, you know, simple level of play, combination play. And they're taking turns, right? So it's not that the parent is just handing the items to the child for the child to put in, so that would be more work in a sense. And when he tries to take her block, she says, "Mommy found one," not "my turn." Mommy found one, and she puts it in. So that we develop this kind of reciprocity in the interaction, in the routine, so that it keeps going, right? You know, it's like you do, I do, we do, right? So we're together in this. Mom is giving some input on pointing. She's also labeling with her language. So that's a nice, clear, simple kind of routine. Do you want to add anything to that? No? Okay. So now, once you've developed this kind of simple routine, you want to expand it, right? Because you can only do that for so, you know, once it's completed, how do we keep the engagement going beyond that finished little activity? So you want to think about each part of the play routine. So you can expand it, any of these parts, but you want to add one more step to the play routine. And you want to make sure that the new routine still matches the child's play level. Another reason why in the environment you've got lots of options at the same play level. Okay? So in this expansion, you'll see again the same little boy, and again he has moments of just, you can see he's just not totally engaged with the toy. So when that happens, when you've had a routine and then you have these moments of just sort of disengaging, you might expand. If the routine is already established, you'll expand. The one danger is you don't want to expand too soon. So you've got to establish some kind of pleasurable routine and then you expand it. So in this case, watch this and then we'll talk about it. Okay, so they were playing with the train tracks, disengaged. She brings over another structure that has a ramp that goes down that train track. That's an expansion. Models, you know, the truck going down, and then he expands it himself by putting the truck or the car into the little tunnel. Okay, so he's actually doing expansions too, and then you build on that, and you can make the routine keep going. Does that make sense? All that's at his play level. It's a toy that's got lots of options, right? You can put in, you can put under, you can put on. So those are good kinds of, in terms of toy choice for him at this play level. That's a good choice. Yes.
So if he didn't do the expansion, then that's where the therapist should have done, maybe put it in or under.
She might have modeled again, yeah.
Okay.
Or she would, if he did something else, she would imitate. So you see that she's now imitating him.
Right.
So again, it's always paying attention to imitating him more than modeling. But if he's unengaged and doesn't know what to do, you're going to model.
Right.
Right.
And then build off of what he does.
Build off of what he does.
Right.
Right. Because we find that the kids really have good ideas. They have great ideas for play, and we can build on them. And this is the kind of fun part of this intervention, is it can be very creative. So the more playful you are, the more creative you are, the better you are at keeping these routines going. And the goal here is not that this child plays with an adult for the rest of his life, but that in fact we're giving him some play skills at this level, so hopefully we can transfer that to peers or to other people, or give him options, give him the confidence that he can actually find toys and know what to do with them and have fun with them. So you'll also notice that the adult does try to use a fair amount of positive affect. So she's smiling, he's kind of a poker face little guy. We're still going to use positive affect, right? We don't want to match his affect. If he's very labile, we're going to be a little calmer, right? We're going to use good clinical skills. But we do want to show positive affect. It's play. It's supposed to be fun. This is what kids do. Okay. Then we're also, so I'm just talking not so much about the sequence in the phases, but what we're going to be doing with these children. So just few select modules. We're going to model joint attention skills. So we're going to model those skills when you play with a child within the child's attentional focus. What they're looking at, we're just going to give input. We're going to point, right? We find, you know, we've been doing this for a while now, we just find that that's much more successful than trying to recruit their attention and make them do these things. It doesn't have a lot of meaning for them. So we're just going to give him the input. You know, eventually we may prompt, depending on the child, because we definitely want them to be using points and shows and some of those joint attention skills. We're going to have much more success if we do that within an established play routine. And the play routine has to be long enough that there's some meaning there. So in the last example, where he put the truck into the tunnel, there's a little flap. Eventually, in a routine, you could pull out the truck and say, my truck is red, or whatever might be appropriate. So there you've got a show. So you can model those as well. Okay, right, because modeling joint attention is going to help them initiate joint attention. So here's a mom and a child, and she's modeling joint attention. Okay, so she does a nice job. It's not always perfect in a child's attentional focus, right? But it's pretty good. And she was really good about labeling and modeling the point. So it's a good example. All right. So we also want to imitate and expand language. So again, using clear language that matches the child's level of language development. So we want to provide the language that's really contingent on where the child is looking. And we want to label and comment on those items that either the child is playing with or the child sees. So the last example where the mom is saying, it's daddy, it's mommy, okay? So she's labeling something in his attentional focus, something he's playing with, and the language is simple. We also want to expand on the child's communication. So they might say one word. We're going to repeat that word and add a word. And the languages, the choices are within what the child is playing with. So we have a lot of language on colors because the children like colors and they know colors. So if they are learning the word block, we might say blue block or, some other color, and they'll pick up on that. If they said yellow block, we might say big yellow block, right? So just mirroring and mapping those words and using words around the play routines, so simple nouns and verbs. Okay, so here is an example. Is it kind of dark? It is kind of dark in here with all the lights. Imitating and expanding language. Let's see.
Let's skate using this one. Where's my skateboard? Oh.
Okay, let's listen to that again. That's hard because it's really quick.
Let's skate using this one. Where's my skateboard? Oh.
Okay, unengaged protocol. So we're going to talk about this one because we saw a fair amount of unengagement yesterday in our little guys. So we want to wait. First of all, you don't jump in immediately. You just wait. You evaluate your environment. So you want to move toys closer to the child, right? So for example, the little guy that was wandering around, so the natural tendency is to go nab him and sit him down. And sometimes you're going to do that. But in this case, I would take a least to most directive approach. We would find a toy that maybe he was interested in or we think he's going to be interested in, and we're going to bring it up to him. In fact, we might put it on a little table if he was wandering and that table was more at his eye level. All right, so we're going to try that first. And if we might play at the table for a minute or two, or we might just bring the toys to him to show him, and then he will come and follow you and you will bring him to the floor and sit down. So that would be the least intrusive. There are other times where you just need to corral him and make your space smaller, and you can use your body, use the environment in some way to help him set. Children who are wandering are not very engaged, and so we have to change that situation for them. Okay, so that would be one issue of in terms of the environment. The other is to offer choices. So you might imitate what the child is doing. you might model something new. We saw some examples of that where the child had these unengaged moments, and so you're going to expand, model something. It just depends on the child and the play level. And then for little guys, like the one we're going to see next, we're going to try some person engagement. He likes singing and person, he's at the level where he's spending a lot of time in person engaged. We're going to use that and then try to incorporate that into objects. But we're not expecting long routines or long periods of time with objects for a child who's really wandering and not very engaged and at this sort of indiscriminate play level. So we're going to need to be very careful about how we move him into an engaged state. But we want to do that pretty quickly, right? We're just not going to have high expectations for long, rich routines. We're going to build those. Okay. So here's an example of a little guy who came in, a toddler. So we're showing you toddlers because we're actually going to be seeing toddlers next. And then we'll show you what he looks like after 20 sessions, so 10 weeks of intervention. This is with Mom.
Favorite Joey on the speaker. Who's this? Oh. Looks like you. Matthew. Oh, Aiden ride bicycle, huh? Do you drive bicycle, Matthew? Do you drive bicycle?
Okay, so when they came in, Mom had some nice strategies. You know, she's trying really hard, but she's also has strategies where she's trying to model a lot and get something going and not really focus on what he's doing. And then when he is focused on something and she's talking, that was nice, talking about what he was doing, but then she's kind of poking him, wanting an answer. This is very typical, right? Because you want the child to engage with you, and why don't they engage? So it's, you know, we have to help parents understand sort of what are some good strategies for changing that situation. So this is a little guy who's verbal coming in. So there's, you know, a lot of potential there to change that environment. So let's see what he looks like.
It's a bicycle. Green bicycle. Blue bicycle.
Which bicycle? Boy, where's my boy?
Where's your boy?
Green. Wait.
Let's see.
What's green?
I see a skateboard. Oh, skateboard.
With my skate. Where's my skate?
My skateboard.
With this one.
Oh, you got this one.
Okay, so Mom did model a little bit, but she gave up right away when he didn't follow in on that, and she went back to what he was interested in. They had a nice little interaction. So she'd learned some strategies and she was using them, and I think that the interaction seemed more together. Okay. So let's review now our treatment targets for the little guys we're going to see. So, child 1. Joint attention points, so modeling those joint attention points. We're not expecting him to point and using a joint attention point, but we're going to make sure that we bring that into the interaction. We're thinking that he's at the simple play level, right? He's really at, you know, indiscriminate, discriminate acts level, and so we're going to try to just play at that level for the most part. Simple play level. We're going to focus on, in terms of engagement, people and object, right? Because we had him wandering a lot yesterday. So the first thing to do is use some people games, some people engagement, and try to get some object focus. You know, our goal is to get to supported joint, but we'll see how this goes with him. And we just want to really get him engaged in any way we can. So the toys that we're thinking would be appropriate for him would be things like puppets, right? Because you can do people games and have an object, so you can kind of transition between the two. We like the puppets with the big mouths, but I'm not sure that's what we have. It is what we have. Good. Rockets, and when we say rockets, these are those kinds of things that pop off, that you can, it's kind of like a spectacle, and then you can develop a little routine with that. It's very simple, but just to get the child engaged. Bubbles help for a moment. The little pig toy, which is the little coins that go in the top and they come out. So he's not really at that level, but we could start to model and use some of the actions of that pig. Puzzles, possibly, and songs. So what we'll do with him is we'll take the first therapist who's going to work with him, and we'll walk through the environment. We'll have you choose the toys that you want to start with and set up the environment. And then we're going to do, actually with him, because he's fairly unengaged, we're going to have our therapist kind of establish some routines and kind of back you in. I think that's the safest thing to do for this one, because it's not easy. It's not easy. With child 2, again, joint attention points would be a target. He is at combination pre-symbolic play. That's what he showed us yesterday. And for engagement, we're going to try to get supported, coordinated joint engagement as targets. So for him, the toys are different. So that's good. We have 2 little guys that still are within this functional play, developmental area, but different skills. So we have magnet tiles, blocks. We have some dolls because he showed us yesterday that he had some interest in dolls. We have a bus, and we have a little roller coaster that has dolls and actions, ramps, things like that we can use. So I think these are the kinds of toys, and we may find a few other toys, but these are the toys for these 2 guys that are within their play level, right? And it allows enough options that we can expand a routine should we get one going, which we will be hoping for.